for supine. This group of muscle is not easy. Okay, so the hip abductors are not. And you see a lot of stroke patients, when you test the hip abduction inside lying, it's still not working. Even if they're in therapy like every day, okay, and still they don't have good hip abduction. Okay, the QL is bilaterally innervated and they are collinear with the hip abductors, right? Same line. They are the antagonist to the strongest component of the extensor synergy, the hip abductors. And also the lower extremity external rotation decrease the abductors efficiency. Okay, so there are many factors why those muscles are not easily activated. So to do the hip abductors, so stages 2 and 3, okay, we're gonna work on facilitation. So do they have them? Okay. Would start, this is the affected side, I would start in abduction. Applies stretch on the group, on the muscles, right? And all my target here is to have the limb move into the neutral. I don't want more. If more comes, that's great. But just make sure that the patient does not go this way. All of them, they would use the hip flexors. So the hip flexors and hip abductors, if you remember the synergies, they are in the same synergy. So activating the hip abductors would activate the hip flexors and the limb will go this way. That's why I said, I just want it to be here. See? Sliding the heel on the table. Of course, it's going to be hard if you're working at home or a hospital bed. The friction here is high. Okay? So at this point, you can use something like that for your patient at the heel, and this thing is moving very easy there. So if you don't have this, you can use a sliding board, one of those. I don't like the one with the hole at the ends for these exercises and for the hamstring exercises. It has to be solid, no holes on it, okay? Get the patient having a pillowcase here or socks or something, so decreasing the friction of the movement. Okay? So the whole idea, I'm now working on getting the limb just sliding on the table. My next step is have this limb here. Now I'm gonna ask her to do abduction of that limb, of the less affected side. More, I don't see any movement here. Keep going, push more, more. That activates the abductors on the other side. So the more resistance you add here on that side, okay, keep going, push, push. The more activation you would see on the abductors on the other side. And you would not go this way. It's gonna be just a sliding on the table, okay? And I just want to the neutral, no more than neutral. The other thing also, for this less affected side, for the affected side, make sure that the limb is not externally rotated. Okay? If the limb is really externally rotated, I'm gonna rotate it here. Okay? You would see more movement of the limb is neutral or even internally rotated. Okay? So push out here. The limb on the other side is moving. Okay, so I use the stretch, I use the associated reactions. Okay, once my patient is there and is able to do the movement, okay, I'm gonna start adding resistance from here to there. My resistance could be applied here or here, right? Okay, so depending on the strength of the patient. But remember not to allow this movement. It's always slide your heel on the table. Okay? My patient now is able to stand up and do the same movement in standing. Okay? So I have them standing with hold on something there. Okay? Should be higher a little bit for her. For the hip flexors, we use the ankle weights, right? Can we use ankle weight here? Can you? Is it okay to use ankle weight? Is it ankle weights are better or having an elastic band?
No, band.
A band.
Yeah.
Why?
Peak resistance.
Say it again.
Resistance. Asymmetric at the end.
Isometric at the end. Okay.
Contraction. You're stabilizing on the opposite side while you're
Okay.
more functional.
The patient can control how much they move the band.
They
as opposed to-
control much with the band.
As opposed to-
Okay. And the resistance is fixed. If you use the weight, patient now is here. The weight is, gravity is eliminated, right?
Yeah.
Right? Only they would feel the resistance when they are here. And if you have 2 pounds weight, it would not be 2 pounds because the force is going to be analyzed into 2. Right? The only fixed resistance that you would have is from a band. So you can start with the yellow one, move into the, which one? Red, right? Green, blue, and it's also task specific. Why it's task specific? Yes, single limb. We do that every day, right? Okay, in some activities, you need the flexors, the abductors on the other side also to be active, right? Okay, for those muscles, especially when you go to stage 4, you activate them bilateral. Never do it unilateral. Right? Because when the patient is standing on this leg, okay, this leg preventing drop of this leg, and this leg prevents drop of this leg. So you actually need the hip abductors on both sides, okay, to be activated. Even the sound side, even it's not involved, okay, but you need them to be strong because when I'm standing here and doing that, the abductors of the involved now, they are working to support the other side. So especially for the hip abductors, we do both. It has to be bilateral. Okay.
I have 2 questions regarding 2 different exercises. For hip abduction, at what stage would you do like sideline against gravity, either clamshells or straight leg?
Okay. So clamshells are external rotations. They are not really abduction. Okay.
Or straight leg.
And